You know, with every single breath you take, there's an invisible war being fought inside your body. It's this constant, nonstop battle between your defenses and this whole army of microscopic invaders just trying to set up camp. So today, we're going to go behind the front lines and really understand this battle, the one for your respiratory tract. I mean, have you ever really stopped to think about it? When you get a cough or a cold, what's actually going on in there? Because let me tell you, it is so much more than just a little tickle in your throat. It's a full-scale invasion attempt. And that's what we're going to do. We're going to check out the battlefield, we'll meet the invaders, and we'll see exactly what happens when those fortress walls get breached. Okay, so first things first, we need to understand the terrain. Your respiratory system, it's not just there for breathing. Think of it more like a heavily, heavily defended border, specifically designed to keep any and all intruders out. So here it is, the battlefield itself. It's really split into two main zones. You've got the upper respiratory tract. That's all the stuff up top, your nasal cavity, pharynx, larynx. You can think of that as like the outer wall of the castle. But then you've got the lower respiratory tract. This is the trachea, the bronchi, and the lungs themselves. And this is the inner sanctum. This is the area that needs the absolute most protection. All right, so who are these invaders? Who are these microbes constantly trying to breach the gates? Well, let's meet the cast of characters, because trust me, they are not all created equal. So on one hand, you have what we call the professional invaders. Now, these are the real elite special forces of the microbial world. We're talking about true pathogens, like respiratory viruses, that can take on a perfectly healthy system. But then you've got the opportunists. These guys are more like scavengers. They kind of hang back and just wait for a moment of weakness. Say you've just had a viral infection and your defenses are down. That's when they strike. A perfect example is something like Staphylococcus aureus sneaking in right after you've had the flu. But hold on, our body isn't just some sitting duck waiting to be attacked. No way. It has this incredibly sophisticated, multi-layered defense system. And really, these are the heroes of our story, the guardians of the fortress. And what's so cool is how the defenses change depending on the location. So up in the nasopharynx, you've got these physical barriers, right? Nasal hairs, for one. And then there's this thing called the mucociliary apparatus, which is basically a self-cleaning escalator coated in sticky mucus that traps invaders and just moves them right out. It's wild. As you go deeper, you get the powerful cough reflex and specialized antibodies. And then, way down in the lungs, that's where you find the elite guards, the alveolar macrophages. These are special cells that literally eat the intruders. But what happens when these amazing defenses are overwhelmed? Or somehow bypassed? Well, that's when the invasion begins. And you know where it often starts? Right at the main entrance, your mouth. Yeah, this probably looks pretty familiar to you. It's dental plaque. But here's the thing you have to understand. It's not just some leftover food. Oh no, it is a living, breathing, organized community of bacteria, a biofilm, that has successfully set up a colony right on the surface of a tooth. So the most important point here, the thing to really get, is that plaque is an active bacterial colony. It's a sticky film that is constantly, always forming on your teeth. And if you don't break it up, if it's not disrupted, it just creates the perfect environment for much more serious problems to start growing. And here's how it all goes down. It's pretty simple, really. First, you get these pioneer bacteria, something like Streptococcus sanguis, that attach to the tooth. Then, as that little colony starts to grow, they produce toxins, and those toxins start to injure the gums around them. And that is why physically removing it, brushing and flossing, is so absolutely vital. It is literally the only way to break up these tiny bacterial fortresses. So what happens if that plaque is just left alone, if it's left to its own devices? Well, this is the result. This right here is dental caries, which you probably know better as tooth decay, or cavities. So what's actually happening here? Well, essentially, the bacteria in that plaque are having a feast on any sugars you eat. They produce acid as a waste product, and that acid starts to dissolve, or, demineralize, your tooth enamel. And once that hard outer layer is weakened, the bacteria can just march right in and invade the tooth itself. The easiest way to think about it is like a recipe, right? You need 3 key ingredients to cook up a cavity. First, you need the right bacteria, like S mutants. Second, you need a food source for them, which is dietary sugar. And third, you need a susceptible tooth. The good news is, if you remove just one of those ingredients, you can stop the whole process in its tracks.
Okay, but the battle doesn't always just stay in the mouth. Sometimes, when invaders manage to get past all those upper defenses, they can reach the most critical territory of all, the lungs. And let me tell you, this is where the fight gets really, really serious.
So, the big question, what exactly is pneumonia? I mean, we've all heard the word a million times, but what is it? Well, at its core, pneumonia is an infection of the lower respiratory tract, one that causes inflammation deep, deep inside the lungs. And believe it or not, where you get it matters a lot. There's community-acquired pneumonia, or CAP for short. That's the kind people get just living their daily lives out in the world. But then there's hospital-acquired pneumonia, or HAP. And this one's different. It's an infection that develops 48 hours or more after you've been admitted to a hospital. And the scary part is, it often involves much tougher, more drug-resistant bacteria. So that brings up a really important question. Who is the most vulnerable in this fight? Who really needs to be the most careful about keeping their defenses up? Well, it turns out quite a few things can weaken your fortress walls. Age is a huge one, just because our defenses naturally get a bit weaker over time. Smoking, that directly damages the cilia. Remember those little cleaning hairs in your airways? Gone. And having a recent bout with the flu can act like a battering ram, just knocking the door down and clearing the way for a secondary bacterial pneumonia to waltz right in. On top of that, things like chronic diseases, say diabetes, or a depressed immune system, that just means your internal army is already stretched thin, fighting on other fronts. And this is why understanding all of this is so unbelievably critical, especially from a medical standpoint. If a doctor knows which pathogens are likely to be causing the problem in a specific situation, it allows them to choose the right antibiotic right from the get-go. And that leads to way better outcomes for patients. And it's an absolutely crucial weapon in the fight against antimicrobial resistance. So that invisible war we talked about, it's raging on inside you right now, whether you feel it or not. Your body's defenses, that internal army, they are working 24/7 to protect you. So the real question, the question to leave you with is this: what are you doing to support them?